3 years ago at Expresstone Laboratory, when we were first introduced to this technology, we were so impressed with it that we introduced it and presented it to some of our premier doctors, helping them implement this technology into their practices. They were so blown away with it that they haven't used a traditional impression since. I am still surprised 3 years later at how often I am asked the question, what are the benefits of using digital impression technology in my practice? When looking at traditional impressions, I don't think I need to go into much detail of why you would want to switch to digital impression. Here are just some great examples that a lot of you have probably seen in your practices of what can happen when using a traditional impression. Without question, PVS impressions may continue to have a place in the dental industry for some time, but thankfully, digital impressions allow us to get a more precise impression efficiently. As you can clearly see, a digital impression provides a high level of quality. There is no guesswork. Digital scans provide an accurate 3D impression. Regardless if it is a single quad or a full mouth, digital impressions capture all the information for creating prosthetics accurately and efficiently. Again, there are many benefits to digital impression scanning. These are just some of the top benefits that we see with our offices. One of those top benefits is the communication between a dental office and the laboratory. The OmniCam software allows doctors to mark their margins to show us where their finish lines are. It also allows the doctor to check the impression in a full color 3D scan that they're able to rotate and check to make sure that they have all the required information to produce the desired restoration. It also reduces bad impressions because we're able to look at it on such a big screen. We're able to analyze it right there in real time. Also, it is delivered to the lab immediately, not allowing for it to be set aside or forgotten about in the busy schedules that sometimes offices have. Reducing procedural costs is another benefit that the digital impression scanners offer a practice. Now there's several of these, we're just going to hit over a few. One, and the first, is PVS impression. We know that these are kind of costly. Also the shipping costs between a lab and a doctor's office. Also chair time. And if an impression is bad, now we have to go back and revisit all those costs. One of the greatest benefits to digital impression scanning is that of the patient experience. Patients hate having traditional impressions. They don't like having all that goo shoved in their mouths. They also don't like having to sit there while the PVS impression goes through its curing process. Also, they might slip while they're sitting there in that impression process, which now distorts the impression. Also, the typical fabrication time that a typical laboratory takes off of a PVS impression is that of 3 weeks to a month. At Expresstone Laboratory, we get it turned around in 3 days. One of the real beauties of the Sirona digital scanners is that there's no follow-up costs, that you're not having to pay every time to send the impression out, that the lab isn't having to pay a fee just to accept those cases and passing that burden onto the office. At Expresstone Laboratory, we have the opportunity of working with several intraoral scanners. Through this process, we have come to the conclusion that the OmniCam DI is the leader of intraoral scanners. From the handling and the size of the wand, that is the typical size of your handpiece that a doctor uses, from the fact that it is powder free, from the full color 3D imaging, from the fact that it not only works as a digital impression unit, it also works as an intraoral camera and an intraoral video camera so that you can further educate your patients that it has a built-in warmer, that the cleaning and calibration process is very easy, that it has not only auditory but visual cues while scanning. It has a battery backup, so that way you can unplug and move it from op to op without having to shut down the machine and plug it back in and turn it on every time. And from the scanning technique being so simplistic. Here's a demonstration that illustrates how easily it is to scan inside a patient's mouth. The acquisition phase of the Sirona Omnicam DI is so comfortable, pain-free, and non-invasive that it's no wonder that patients prefer this over a typical PVS impression. Also, as a dentist, it's very useful because we're able to see on the screen, especially on the left-hand screen, the exact information that is going on inside the patient's mouth. We're also able to see on the right-hand side the model that is being stitched together and generated as we scan, all in real time. When we're talking about the patient experience, I think this traditional impression right here illustrates how enjoyable a traditional impression can be. I have no doubt in my mind that the patient enjoyed having their PFM bridge and root pulled out of their mouth when taking impression for the two posterior implants. We all know that patient experience is probably one of the most vital things to a dental practice. So when we're looking at things to implement into the dental practice, we want to make sure that they're things that are non-invasive. We want to make sure that they are enjoyable to the patient. And we want to make sure that it's going to heighten the patient experience to the point that they're going to want to go out and tell all their friends about how enjoyable that experience was. At Express Dental Laboratory, we feel that communication between doctor's office and lab is essential in providing the greatest patient experience possible. At Express Dental Laboratory, we're able to produce various prosthetics off of these digital scans, from single unit EMAX and zirconia restorations to full contour gold to full mouth rehab cases, from your implants to screw retain to partial metal framework cases. All of these can be easily accomplished off the digital scan veneers. You're also able to use the ortho software to scan to send to Invisalign or ClearCorrect to get retainers made. Digital impression technology has revolutionized the dental industry so much that doctors are once again excited about practicing dentistry. The question you should be asking yourself isn't, what are the benefits? The question you should be asking yourself is, how quickly can I implement this technology into my practice today? We hope this short presentation has helped in your decision of implementing and adopting the Sirona Omnicam DI unit to help better serve your patients and streamline the impression process within your practice. For more information, contact Express Dental Laboratory at 405-217-2282. Thank you.